In this just-in-time training video, we will be discussing the role of ammonia inhalants. Do they do more harm than good? What are the associated risks? Are there better ways to arouse our patients? Hello friends and EMS professionals, Stephen Sione here, training captain for Ada County Paramedics. The grandfather of EMS medicine, Dr. Bledsoe, stated prior to 2008 that regardless of whether a patient may be pretending to be unconscious, generally there's a medical or behavioral health reason, and he doesn't need to remind us that all patients deserve to be treated with dignity and respect. Dr. Bledsoe goes on to say that ammonia can be harmful and in some cases fatal. Therefore, ammonia inhalant is not an innocuous agent. Someone please find me where in our standing written orders that ammonia inhalants are mentioned. Don't worry, I'll wait. No, really, they're not listed in our SWOs, yet we've carried them for years. Smelling salts are a mixture of ammonia and other chemicals that have been used to revive people who have fainted, or more likely in our practice, to determine whether a patient is faking consciousness. When placed under a person's nose, the fumes are inhaled and irritate the inside of their nose, which triggers a deep breath, clearing out their nasal passage. When the resulting oxygen hits your brain, your sympathetic system responds with a fight or flight reaction that sends adrenaline through your veins and temporarily makes you more alert. Yeah, all that sounds great until the Journal of Emergency Medical Services points out that there is no approved use for ammonia inhalants to treat a medical condition. Oftentimes, this is just considered a punitive measure. It's our job to treat all patients in a non-judgmental manner and follow that age-old rule of first do no harm. But wait, what the what? How bad could it be? Ammonia can worsen pre-existing respiratory conditions. Ammonia may produce coughing or nausea and vomiting, which would increase the risk of aspiration in patients with an impaired gag reflex. GEMS points out that the violent physical response to ammonia may compromise the integrity of spinal canal in patients with a spinal cord injury. The wild and forceful motions caused by this noxious agent could pose a challenge to patient or provider safety. But how will I know if my patient is faking it? Fool me once, right? Who's old enough to remember the good old hand drop test? Or perhaps worse, who's ever witnessed the nipple squeeze technique being used? Geez, people, please don't try these. But just like those silly old tests that we used to use back in the day, ammonia inhalants have also gone out of style. Heck, even the sternal rub has been called barbaric by some. You may, however, attempt the fluttering eyelash technique or the trap squeeze. If the airway needs to be protected, then maybe an NPA is appropriate. Although we may suspect that the patient is being less than honest, such thoughts should not impact our patient care or decision making. Before we determine if a patient is faking injury or illness, we must exclude all other medical and psychiatric causes. More oftentimes than not, there's a medical or a psychiatric reason for the patient's behavior. So let's uncover that and show them some grace. Remember, sometimes it's just our job to get them to the hospital where they can get access to the resources that they really need. And we simply serve as an important link in the chain. So now what? Ammonia inhalants will be removed from the bags and rigs and will not be used by our access providers. The decision has been discussed and decided upon by the SWO committee with approval from the medical directors.
I would like to discuss with you the recent decision by the Standing Written Order Committee to remove ammonia inhalants from our bags in the field. I know that there is some trepidation from our seasoned providers who are used to using these, and they have had some previous utility, but the current evidence does not support utilizing ammonia inhalants to differentiate medical diagnoses in the field. It can actually lead to some patient harm, and after review of the current evidence and the current literature, it does not support the day-to-day use or employment of ammonia inhalants in EMS. As with any decision, we are always available to discuss this with providers who have concerns. Please reach out to us either by phone or email, always available to chat with our providers regarding any decisions we've made going forward. Thank you.
This has been another edition of an Access Just-in-Time training. Thanks for watching. Stay sharp and stay safe.
Hi, it's Dr. Urban with Access. Hi, it's Dr. Urban, one of your co-medical directors. Dr. Cornett couldn't be with us this afternoon. He's off gallivanting in the mountains with a backpack to work for the VA and always be on divert.
Where are my Skittles? Won't you tell me how to get to Sesame Street?
Bad. Stop. This is why we can't have nice things.
How's it going? You're in the back of an ambulance.
Someone shit my pants.